NAPOLI-1 was a phase 3 trial looking at the added value of nanoliposomal irinotecan in combination with 5-FU versus 5-FU alone in patients with defined as GEM pre-treated metastatic pancreatic cancer. And so this poster presented a post-hoc subgroup analysis trying to look at the question of the impact of the number of lines of prior therapy to that benefit that was seen in terms of overall survival. And about 2/3 of patients had had 0 to 1 prior lines of therapy, and the remaining third had had 2 or more lines of therapy. And the importance of that is that when we typically think of metastatic pancreatic cancer, we do recognize that as patients progress across lines of therapy, there may be, despite the fact that they're trial eligible, may be confounding factors that may impact on benefit and a differential effect that was observed. So in this analysis, what was demonstrated was that indeed patients who had only 0 to 1 prior lines of therapy did appear to have a greater magnitude of benefit in terms of overall survival. So the delta was about 2.2 months, I believe, compared to about 1 month in overall survival difference for those who'd had 2 or more. So, I mean, I think that the takeaway for me in that analysis is that it does appear that offering patients nanoliposomal irinotecan earlier in their metastatic disease course is important, but there is still value potentially for patients who even have had 2 or more lines of therapy. In how we practice in our practice of advanced pancreatic cancer currently, and how we interpret the data of NAPOLI-1, I think most of us look at nanoliposomal irinotecan as something we would consider after first-line gemcitabine progression. So typically, most of our patients would fall in that 0 to 1 category of eligible patients. And whether you could think of it in earlier lines of therapy is an unanswered question. The one scenario in which I might consider it would be in patients who were early adjuvant treated failures, so patients who'd had adjuvant gemcitabine and then shortly thereafter progressed with metastatic disease, in which case one may consider the suitability for nanoliposomal irinotecan.